Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. It's been several weeks since we've given you an update about COVID-19. And as you're probably seeing in the news, the Omicron variant is getting a lot of attention. Over the last 7 to 10 days, we've seen a change in our situation, so we thought it was time to give another update. Now, the data I'm going to show is as of Wednesday, December the 22nd. So let's get started. So this is our outline for the next few minutes. We'll discuss the current regional hospital status, then Omicron, then discuss the flu because it's pertinent this time around, address healthcare staffing nationally, and then try to sum it up with what this all means and next steps. So this is a historical slide about the regional hospital situation. This is from April of 21 to September of 21. You see that before the Delta surge, regional hospitalizations dropped as low as 23, and the region is defined by the counties at the bottom of the slide. And then it shows the spike, which was the Delta surge in August and September. This is now August to current. And what you see is after the Delta surge, the regional hospitalizations never dropped below 127. And currently, hospitalizations are at 217. And so whatever we're seeing right now, whether it's still Delta or whether it's Omicron, we see we were starting at a much higher level of hospitalizations. And although it hasn't really spiked, it has continued to slowly increase upward over the last few weeks. This is for our medical center. We currently have 52 patients with COVID-19 in the hospital. If you see on the graph on the right, though, that there has been a significant increase in the recent several days. And so we're watching this very closely. Then in the lower left, you see the difference between fully vaccinated and not fully vaccinated in terms of those who are hospitalized. Now, it's important to note that we've only recently started gathering data about the booster for hospitalized patients, and we're in the process of validating that data. But for this slide, fully vaccinated means that they've completed a primary series. It doesn't comment about the booster. So now let's talk about Omicron for a few minutes. So what do we know so far? Well, we need more data to be certain, but it appears that people with infection-induced immunity, meaning that they were infected previously, they are not well protected from Omicron. And the increased risk of infection is 3 to 8 times higher than for Delta. The doubling time for Omicron is extremely rapid. It doubles every 3 to 4 days. Now, is this variant milder? Maybe. The World Health Organization chief scientist was quoted yesterday as saying it is probably unwise to sit back and think this is a mild variant. It's not going to cause severe disease, because I think with the numbers going up, all health systems are going to be under strain. Also, importantly, it's unclear that the currently available monoclonal antibodies are an effective treatment. And we have had a sense that many people have felt that the monoclonal antibody was something they could rely on in the event that they contracted COVID-19. What about the vaccines and Omicron? Immune evasion will lead to an increase in new infections across the board, regardless of vaccine status. So previously vaccinated, or as we said, infected patients may not produce enough antibodies for Omicron. But we do hope that the T cells, those are those memory cells in your immune system, will maintain the ability to prevent severe disease. The recent recipients of boosters demonstrated increased neutralizing antibodies against Omicron, and this is good news. So the early data, and again, this is still developing, but so far vaccine efficacy against symptomatic Omicron after 2 doses of vaccine seems to be 30 to 50%. And we have to keep in mind that historically the flu vaccine, which we've believed in for many years, has about this level of effectiveness. After 3 doses, meaning a booster, it's 70% effective. And the vaccinations do appear to provide protection against severe disease. So now let's talk briefly about influenza. Nationwide, influenza hospitalizations are increasing. Across the state, of all of the flu tests sent, about 8.5% are positive. This time last year, there were literally no flu cases. At our hospital, about 5% of our tests are positive. And again, we had no flu cases last year. And our lab has had 94 lab-confirmed tests and 20 admissions since November 13th. And so while this may not seem like a lot, the future of the flu is uncertain, and combining that with COVID can affect the hospitals. So now just a brief word about the current state of national healthcare staffing. So the U.S. healthcare sector has lost nearly 500,000 workers since February of 2020 per the Bureau of Labor Statistics. 18% of healthcare staff have quit since the pandemic began, and between 35 to 54% of U.S. nurses and physicians already felt burned out before the pandemic. Also, the American Nursing Association has urged the U.S. Department of Health and Human Services to declare nurse staffing shortage a national crisis, and that was back in September. So the staffing issues that hospitals are seeing, it's not just a local or regional issue, it is a true national issue, but it is of concern. So what does this all mean? First, it's likely that many people, both vaccinated and not vaccinated, will likely be infected with Omicron in the coming weeks. Boosters are your best protection to avoid it altogether if you're eligible for a booster. We do have concern that for non-vaccinated individuals, there is significant risk in the coming weeks. Also, holiday gatherings will likely accelerate and potentially worsen the overall situation. Now, from a hospital perspective, we do have concerns about potential access to care developing as it did during the Delta surge. And this is for 3 reasons. First of all, healthcare personnel may also become infected with Omicron. And even if vaccinated personnel develop mild disease, they still can't work, and that could affect staffing issues. Secondly, we may experience an Omicron surge of patients in the hospital. We really don't know to what extent, but it's reasonable to expect there will be some increase in hospitalizations. And then third, as we've already mentioned, there are strains nationally to healthcare staffing, and our local area is not immune. So as far as our next steps for the community, regardless of vaccination status, we recommend to renew mask wearing, especially in large groups. Consider taking an at-home test before a holiday gathering, and reconsider large in-person gatherings, especially if older at-risk individuals are present. Obtain influenza vaccines and the initial COVID-19 vaccines if you've not already received them. Restimulate your immunity with COVID-19 boosters if you're eligible. And if you have symptoms, even mild symptoms, get a COVID test. So as always, we appreciate your time. We're going to continue to monitor this situation closely, and we will provide you updates as we feel they're appropriate. Thank you.